I used to think one day I won't be so afraid to walk into a patient's room by myself. But until then, I'll get another student nurse to go with me. I used to think one day I won't be so afraid of doing my assessment. But until then, I'll go very slowly through all the painstaking questions. I used to think one day I won't be so afraid of hanging meds. But until then, I'll take my time and double check all my lines and all my clamps. I used to think one day I won't be so afraid of asking the patients the hard questions. But until then, I'll continue to choose my words carefully. I used to think one day I won't be so afraid of confronting combative patients. But until then, I'll show up to help my team wherever I can. I used to think one day I won't be so afraid of codes. But until then, I'll find a good spot to observe and try to be helpful where I'm comfortable. These days, I'm still afraid of walking into a patient's room. But until I'm not, I'll go in with a positive attitude. These days, I'm still afraid I'm going to miss something important on my assessment. But until I'm not, I'll be as thorough as I possibly can. These days, I'm still afraid to hang unfamiliar meds. But until I'm not, I'll use my reference text and ask questions and call the pharmacy. These days, I'm still afraid to ask some direct questions. But until I'm not, I'll continue to gently beat around the bush. These days, I'm still afraid of combative patients. But until I'm not, I'll continue to learn de-escalation techniques. These days, I'm still afraid of starting compressions in a code. But until I'm not, I'll help my team with other tasks. One day, when I'm a better nurse, I'll walk into all the rooms without fear, because I'll be confident in my ability to handle whatever situation I'll face. One day, when I'm a better nurse, I won't be afraid of missing warning signs in my assessment, because I'll be confident in my assessment skills and my intuition. One day, when I'm a better nurse, I'll be better at knowing my medications, because I'll be confident in the questions I've previously asked and the younger nurses I've had to explain these medications to. One day, when I'm a better nurse, I won't be afraid to ask questions, because I'll be confident in my ability to communicate and talk about the hard subjects. One day, when I'm a better nurse, I'll be able to help a new nurse with combative patients, because I'll be confident in my de-escalation techniques. And one day, when I'm a better nurse, I won't be afraid to start a code, because I'll be confident in my ability to make the right decisions.